Patient safety. When we talk about patient safety, what all we are supposed to ask or we are supposed to take care of? Name, age, confirming name, age, NHS number on report, drug allergies, if it is there, medical or surgical comorbidities, medical or surgical comorbidities, medical surgical comorbidities, Jehovah Witness, addressing her concerns, correct evidence-based management, blood group, RS typing, contraindication as per health condition, honest about the effects. These all are included in patient safety. These domains are very important, that is patient safety. Even whoever is appearing now in exam in May, they should take care of this thing that they have to confirm name, age, NHS number. They have to rule out drug allergy or any allergy, any medical or surgical comorbidity. I'll just give you an example of surgical comorbidity. A patient who has come at 37 weeks of the pregnancy, she wants to discuss her plan of delivery. And if you have not ruled out surgical comorbidities, and if she has undergone for laparoscopic myomectomy or the laparotomy myomectomy, then you have to very particular about the descents or a rupturing of uterus. But if you are not aware of that, how you are going to discuss about that, right? How you are going to discuss about that, because you are not aware of that. You are not asking that particular question. So how you are going to address her safety completely? You won't be able to, because you have not asked this question, and so you compromise patient safety, and later on you all think, why I'm not able to clear the exam? Why I'm not able to clear the exam? That's the reason, because you have missed patient safety. Very, see, delivery plan will completely change. If it is a laparoscopic myomectomy done 6 months back, year back, so not 6 months, she's 36 weeks, a year back or something, probably you will go for planned cesarean. Or you have to take it as VBAC trial. Same. Same. If patient has history of medical history of DVT, or she has family history of DVT, and she has come for the HRT, then it is going to affect the mode of HRT. In this case, you are going to offer patches, right? So that's why patient safety, normally candidate not able to clear this domain, because they do not understand importance of these small lines. Contraindication as per health conditions. Because if you are going to see, patient has come with the obesity, she is in her 12 weeks of the pregnancy, this is your task. If you do not ask any medical condition of concern, and she says It's not necessarily that in candidate instruction they'll give, okay, patient has asthma as well. Now college is also very smart. You know that you all are taking many courses, you are all are aware of recalls. If you see, they never repeat scenario. And yesterday exam, there was not even a single scenario which was repeated. Not a single scenario. They only repeated topic. It was a topic. It was miscarriage, but scenario was absolutely different. Leave 2 or 3 tasks. They may repeat scenario, but in 80% cases, they are not going to repeat scenario. So if you are taking it for granted, okay, that I have read, okay, obesity and 12 weeks, okay, I have to talk this and that. And one more suggestion, this is the very important suggestion, especially who are appearing in May exam. Do not take any task for granted that, okay, I have read this task. Do not read between the lines. This is another suggestion which I've seen many mentors give. That read between the line, okay, this is ST5, okay, this is obesity, okay, no. Read from first P till end S. Read from first P till end S. About S. When you read candidate instruction, rather than reading between the line, be fast reader. This is a suggestion for November student. From today itself, start reading 2 tasks from book. Only read tasks. Go through their investigation if they have provided, and then try to make your treatment plan or your template in that 2 minutes. I'm not saying that you present that or you prepare that 10 minutes task, but just in 2 minutes, read that task, read that investigation, and then make your template in that 2 minutes and just try to check whether you are able to do that or not. Probably today you won't be able, probably you won't be able even tomorrow or day after, but surely after 10 days, you will be faster reader, faster than before. So probably now you will take 3 minutes to understand and reading and going through complete candidate instructions and whatever information they want to give you. So this is an other preparation which you should do in the beginning itself. We are making template task wise, you're going module wise, and then simultaneously pick one book which you have not gone through, because that is again very important. That if you have already read that task before, probably that would be cheating, and you're cheating yourself, right? Cheating myself. So that is not like required, or that is not going to help you. Pick up any book which you have not read before, read that task in 2 minutes, investigation, make your template in 2 minutes in your mind, and then see whether you are able to address all or not. This is a very important tip which you have to follow. Second is communication with patient. This is the second difficult domain I find that candidates not able to clear. Empathy, sensitive, emotions, not monotonous, simple, appreciate whatever is her choice first. Everybody knows empathy. Everybody knows that we have to talk to them sensitively. We have to show emotions, not monotonous. But somehow, when we start doing the task, we forget that. When we talk, see, whenever I have taken many mocks this time. Few girls are looking at the roof. Few girls have closed her eyes. Few are looking very tense. Then there is no empathy, there is no sensitivity, there is no emotions, and not monotonous. You are not supposed to do that. You have to look in front if you can see, because now November onwards, probably there won't be any online. It is going to be face to face. So you have to do practice that way. Even for online, empathy, sensitive emotions rather becomes more important, because in online, They are not able to see your emotions, they are not able to see your hand movements so precisely. So it becomes very important if you are not monotonous. You are empathic, but you are talking emotion. I can see that you are alone. You are looking this thing. You want someone to be with you. It is empathetic, but it is going very straight. Rather, you should utter these lines. I have to share lots of information with you, Diana. I can see that you are alone. Then slightly slower. Do you want someone to be with you? Change your tones. It should not be monotonous. It should not be that okay, you're looking empathetic, but it is appearing as you're reading news. Right? So you have to be empathetic, sensitive, emotion. You have to show your see if you see UK movies, if you see Hollywood movies, they are very while expressing or while talking, they address their emotions. They express their emotions very loudly. Even they talk to a child who is 4 years old, they will talk to that child with full emotions. Not that they are, as we talk in our countries, especially in Asian country, well, no, they talk even to a child with full emotions. When they say, I have seen one reel when there's 6, 7 years old girl, not even I think six, there must be 4, 5. She was talking to her father. That was a reel in Facebook. And when she admitted that I have a boyfriend, reaction of father was, oh, may I know his name? Okay. So, see, this is how they express themselves. And you are dealing with those role players as well. In last day exam, mostly role players were from, it's just English countries. So even when they talk to you, they also come with the emotions. You have to reciprocate in the same manner. You cannot go straight. Yeah, hi, I'm Dr. Arora, one of the doctor posted in Gynae Clinic. May I know this. I'm aware of your loss. Please accept my condolences. You have to change your tone. You have to change your tone. You cannot go, okay, I'm aware of your loss. Please accept my condolences. No. Even with loud voice, you have to be, I'm aware of your loss. Please accept my condolences, Diana. This is how you have to speak. And again, make your communication very simple. Very simple. It should be understandable. Making complex sentences, hi-fi English, we are all Indians or we are all Asians, Middle East countries. English is not our native language or our first language, right? We always think in our language, then we convert into English. So do not try to make it complicated. You will fumble. Better if you make it simple. Making it simple is very important. Then this is the mantra of patient communication. Everybody, this is the mantra of patient communication. Appreciate whatever is her choice first. Whatever her choice, first you will appreciate that. Just a minute. Appreciate. Okay. Whatever choice she has made for herself, even it appears a shitty idea, even if it appears, my God, what the hell she's talking about, you have to say, I appreciate your choice. It will help you in conceiving naturally. You won't be needing any extra injections or drugs, no extra expenses. We'll put you under the care of expert team of keyhole surgeons. They may operate either through keyhole or, if need arises, opening the tummy. You will be in the hospital from 1 to 3 days as per cut given in the tummy. There will be some risk of bleeding, infection, or the injury to nearby organ. The chances of success are almost 7 out of 10. And success depends upon these 3 points. Dinah, Am I clear so far? Yes, doctor. Diana, but I'm sorry, I have few concerns as well. Can I discuss that? First, always appreciate her choice. Again, I repeat, whatever shitty idea she has come with, you have to appreciate, because even if she wants to go for reversal of sterilization, that is not something which is out of the box. That is a surgery which we do, which we perform, that is given in the guideline. So she is not saying something which is like absolutely, weird. Because reversal of sterilization we do perform, we do reversal of sterilization. So you cannot say no, 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 I have concern, this is not the right choice. If it is not the right choice, then why we have given that, why that surgery has been mentioned in the books, why we perform, why NHS funded in a particular case. It means we do a reversal of sterilization, but probably that is not the best idea. Don't we do VBAC? We do VBAC. We do VBAC. So we cannot say, no, 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 we'll not go for VBAC. They have a complete guideline about VBAC. So how we can say that, no, no, that is not a good idea, you should go for cesarean? Then why they have made that VBAC guideline? They have made that VBAC guideline because they believe in that VBAC is possible. So you have to appreciate her choice that going for VBAC is a good idea. Normal delivery always gives you better recovery, faster recovery, more closeness to a baby, and more chances of normal delivery in future. 3 out of 4 women do deliver normally in VBAC trial. So how you can say that, oh my God, why? I've seen that many students, they clearly say, you have come for the VBAC trial. I have some concern about that. So what you're trying to say, VBAC has only concern? Then why they are practicing VBAC there? They should stop it. They are still practicing. It means NHS UK believe in VBAC. So how you can deny completely? You cannot deny completely. You should always appreciate her choice. That yes, it's an option. And these are the advantages. Then say, these are certain disadvantages as well. Can I talk about that? There is no reason that she will not listen to you. There is no reason that you will not clear this communication with colleague. There is no reason. Moving further, communication with colleague is the easiest domain to clear the exam. This is the easiest domain to pass. You have to address MDT on time. It should not be random that in the beginning, I have seen that some tell about the MDT in the beginning only, some talk in the, no, there should be sequence of everything. No, there should be sequence of everything, how you proceed. How you proceed. Normally, how you get ready. First you wear your clothes, then you wear your shoes. It's not other way that you are wearing your shoes first, then you are getting wearing your clothes. It's not that way. Though at the end, you are going to wear both, your shoes and your clothes, both. But there is a sequence. There is a sequence. So you have to follow the sequence here as well. It should not be as you're talking something very randomly. And secondly, when you talk about the MDT, I've seen many times candidates include whatever they see, whatever they, whatever comes in their mind. A student is like, they're adding everyone, whether it is, see, MDT doesn't mean that you will involve all the facilities available in NHS. You will involve whoever is important for that particular condition. BRCA 1, BRCA 2. Why you are involving Macmillan nurse? She is BRCA 1 positive. She doesn't have cancer. Macmillan nurse involved when patient has cancer. When patient is already diagnosed with cancer, then the role of Macmillan nurse starts. But you are talking about faulty gene, BRCA 1 positive, and in MDT, you are involving Macmillan nurse. It is going to deduct your marks. This shows that you are not aware which condition you are talking about, what this condition involves. It means probably examiner will think, okay, you are not aware that BRCA 1 is not a cancer. There is a probability of the cancer. So why you are involving Macmillan nurse? You are wasting their healthcare professional. They are very, very conservative. as far as finances are concerned, as far as involving healthcare professionals are concerned, still they do the home deliveries, where in most of the countries we do not do that. So they are very conservative about finances and the health, and you are involving every damn healthcare professional in all MDT. No, it is not that way, darlings. This is something very important. And these are the points when you think that I've done everything, why I'm not able to clear the exam. These are the reasons we are not able to clear the exam, because we involve which you were not supposed to involve. So MDT on time and the correct MDT, and GP documentation. If GP has sent, then the GP you will revert back to GP. If midwife, then midwife. If some ST1 or ST2, then you have to write that. These are MDT, and GP is basically communication with colleague, right? Then in teaching, because in teaching you are communicating with your colleague throughout the task. Throughout the task, you are communicating with colleague. So in teaching, it will involve two things. First, your communication, and second, definitely if you are involving any MDT or other faculties, right? So in teaching, communication colleague with will be this, and communicating with your junior throughout your task. So that will also, communication with colleague becomes very important in a teaching station. Yesterday exam, there was an exam about the topic that probably that ST1 or ST2 has not managed that station, or that managed that ectopic pregnancy properly. He or she misunderstood whether it's a topic or miscarriage, and simultaneously there was bullying as well. Simultaneously there was bullying as well. Few students were not able to make out bullying. They were thinking that if it is a bullying station, it is going to be a completely bullying station. No, probably that student has come with bullying because he was not aware of the, or he has done the wrong treatment. So probably his senior might have, undermined him. So here in this task, it was not a complete bullying, right? As of now, I have not got the complete questions asked by role players. So I'll definitely, uh, if I get any details about that, I'll let you know. As of now, what I have understood, that it is that way, right? So after bullying, how you have to go further? Just a minute, there is one call. Okay, so here that was a case with ectopic pregnancy and the reflective practice, right? That basically you needed to teach him about how to diagnose ectopic, how to involve MDT, what all professions we have to involve, how to manage ectopic, how to give them discharge and the post surgery or the treatment plan, and then something about reflective practice. Because now that ST2 or ST1 needs to do the reflective practice, and you have to mention is e-portfolio. So that was the complete. So throughout the task in teaching, patient communication with colleagues, throughout the task, you have to be friendly, not be bossy, especially whoever is appearing in face to face, because you have to control your expressions as well. You have to control your unnecessary hand movements as well. Appreciate first, then flaws. Even if he manage it like miscarriage, you have to say that. I can see that you're very worried, Dinah, but at least you tried, and you tried to do as per your competence as much as possible. And that's why you are in the training, so you can learn from your mistake. We all have learned from our mistake. And if you want to be more, because see, MRCOG part 3 is all hypothetical exam. You are assuming and you're talking, and even role player is also talking that way. So you can also add certain conditions, certain situation to make it more hypothetical and looking very authentic. You can give your example that in one time, like, see, I was doing delivery and I couldn't identify breech. Then midwife came and midwife said that, oh, this is breech. Why are you trying for normal delivery? Did you explain the patient? Then I learned how to do the proper vaginal examination and to identify whether it's a head presentation or breech. So it happens with everyone, Diana. You can quote an example. See, it is hypothetical, no? So you can make your lines, you can make situation for yourself. Until unless it is given in your task that you have never made any mistake, Dr. Arora, you have never made any mistake as a candidate. So now you have to address your Dinah that how to take care of that patient, how should have been taken this patient forward. They will not give something like that. So you can also make your hypothetical situation. When she has come, okay, that I'm not able to repair episiotomy, it's still bleeding. Then you can give, okay, oh my God, same thing has happened with me. I remember that was my third episiotomy. Then I had to call ST6 or ST7 or ST5 or my consultant. It happens with everyone. This is friendly and not bossy, appreciating first, then flaws. Then you can give also example after that. I inform all my seniors that whenever they do episiotomy, especially the extended one, they used to call me and I used to come irrespective of time. Even when I was not posted, I used to stand there and just used to look them and used to observe them. Okay. And always ask what she knows. That is very important because this will give you idea from where you have to start. Otherwise, you'll start explaining the definition of ectopic pregnancy, and the moment you'll reach to this management, your 10 minutes would be over. You always ask, okay, you tell me, what do you know about ectopic pregnancy? Okay, this. So did you check for pregnancy hormone? Did you check for a scan? So where you find it confusing, this is how you have to see. Again, I repeat, they are repeating the topic, not the scenario. You have to have that presence of mind when you are preparing your templates. Now, see, whoever is appearing on 15th or 16th, you still have 3-4 days in your hand. Just make your own question. What if she asks this? What if she asks this? So even if you have thought about that question, what happens sometimes? Sometimes you have argument with someone and you are not able to reply. Next time, whenever you meet that person, you always come prepared with answers. If today she'll say this thing, I'll reply this way. You make yourself ready for that situation, right? In day-to-day life, you do that, no? When you're going for interview, you prepare. Okay, if they ask this, I'll answer this. If they ask me, I answer this. You do with your kids, you do with your house help, you do with your relatives, friends. If you have experienced something, any kind of argument, any kind of like conversation, which you think that you were not able to reciprocate equally, you always prepare those questions, those answers, and then you come again, or then again you confront them. So same you have to do in exams only. Prepare all the questions which you think that they can ask. If you see, because it do not prepare task in 10 minutes for you prepare task 10 minutes, listen to you whenever you find your own mistake and rectify it. Other than 10 minutes task, read, write, think all the probable question which she can ask and keep ready your answers for that. Keep ready your answers for that. So if she comes with a new question, which not given in the previous scenario, previous records, which you have read, you will be answered. You will be able to reply not 100%, at least 60-70%. And that is enough to pass this exam. Next, information gathering. This is again, I have seen everyone makes it so complicated, make it so haphazard. But again, it can be very simple, very easy. Divide your information gathering in HOPI, in REST routine. HOPI is whatever is given in candidate instruction and the details for patient in regards to investigation or whatever other information they have given. That is going to be your HOPI. If they have given, say, BRCA1 positive, it's okay. I'll discuss about that link which has come yesterday. In HOPI, they have given that her mother died of this cancer. Her brother died of this cancer. Now she is worried about herself. She is doubting probably she has Lynch. So you can see 3 things in your candidate instruction. Mother died, brother died, and Lynch. Mother died of ovarian cancer, brother died of colorectal cancer. So HOPI is going to be around ovarian cancer. And yes, breast cancer as well, because the other risk with the same faulty gene is this thing. Definitely not colorectal cancer, because you are not going to have that. Then, because, or if it is given that mother has died of endometrial cancer, if they have not given Lynch, then you can think, okay, it can be Lynch. Then your HOPI is going to be first about any sign and symptom of ovarian cancer, any sign and symptom of breast cancer, any sign or symptom of endometrial cancer, and then the general signs of cancer. These four is going to be your HOPI. These four is going to be your HOPI. You know what all questions you are supposed to ask for breast cancer. You know what all questions you are supposed to ask for ovarian cancer. You know what all you are supposed to ask for endometrial cancer. Then quickly ask about the mother. Quickly ask about the brother, that is empathetic. Then routine history. And whatever is the HOPI related question, I always tell to all my students, ask in HOPI itself. Do not leave that once I reach to medical, once I reach to surgical, I'll ask this. Because in that case, for HOPI, you are thinking and asking. For routine, again, you are going to think and ask, then you won't be able to finish this in 3 minutes. If you think for HOPI and you take 2 minutes, then rest you will take hardly 1 minute. Hardly 1 minute. You can just, I'll just give you an example. If you have any stopwatch with you, or if you have any watch with you, I'll just start with that. Will you tell me more about your pregnancies? When did you have last period? Periods are regular? Using any contraception? Are you up to date with your cervical history? Any medical history of concern? Are you allergic to drug or anything? Any surgery in past on tummy or down below? Is there any family history of concern like blood clots in legs and lung or same condition? What do you do for living? Whom do you live with? May I know his name? Is he supportive? How your mood has been in past couple of weeks? You smoke? Take alcohol? Pardon me to ask, any irritation? Are you aware of your blood group? Any reservation about blood transfusion if need arises? May I know your weight to height ratio? Thanks for giving all information. Anything else you want to add in this? I think 40 seconds. Even if you're not even 40 seconds, I think it was very fast. So you just add further 40-50 seconds because your role play is going to. Why I did it fast? Because whatever was important to ask in medical history, which was pertaining to our HOPI, like, were you diagnosed with a special condition? Ever? We call it as PCOD. Any high blood sugar? May I know your weight to height ratio? Because this is something can be the predisposing factor for endometrial cancer. Simple. Then you go fast here, and you'll finish in 1.5 minutes. It is simple. This is my way, but see, if you have learned it in a different way, that's fine. But this is how I feel. You can finish your information gathering. You will be crisp. You will be to the point, and you are not going to miss anything. A patient has come with the heavy vaginal bleeding, post-delivery, or early pregnancy, or molar pregnancy, or whatever. Do not take it for granted because it is molar pregnancy, she's having bleeding. She might be having some blood disorder. Because in UK, they have this bleeding condition, though it's not very common in our side, but it's very common in fair skin. So I would have been in your place. After vaginal bleeding, I would have asked, any blood condition? In PPCM, I would have asked then and there, any family condition or heart condition, or whether you have any heart condition before. So when I go to medical concern, I have, see, do not think that again you're asking medical condition. Here you're asking any, here in HOPI you're asking a particular medical condition. Here you're asking in general medical condition. There's a difference between two. There's a difference between two. So here you're asking any medical conditions, you're asking in general. Here you specifically ask about the heart condition. So you are not repeating the question. That is again a wrong, I would say, impression that I am repeating the question. No. Okay. So make your information getting that way. So I think now I'm clear about all the domains. And last but not the least is the applied clinical knowledge. I know that, I'm aware that everybody is very scared of applied clinical knowledge. But I personally think this is the simplest thing because this is fixed. Information gathering may vary because patient may come up with any question, but applied clinical knowledge is fixed because the GTG for ectopic pregnancy is fixed. Molar pregnancy GTG is fixed. Ovarian cancer GTG is fixed. Graves disease GTG is fixed. You know that what all complication, what all treatment, when you need to repeat the LFT, when you need to repeat the TFT. So applied clinical knowledge is the simplest domain. If you have read the GTG or information leaflet properly, it's always, sorry, this is BBN. It's always start with BBN, diagnosis and investigation. Diagnosis and investigation. Then complications. What all complications she may have because of this condition. What all risk factors she had, that's why she had this condition. If it is ANC or MM, maternal medicine, then what impact she is going to have on her pregnancy, maternal, fetal, both. This should be a sequence for all the tasks. You have given her lots of complication facts, which is fearful. Immediately after that, offer MDT by BBN diagnosis, complication, and the MDT. You are making her aware of all the complication, then you are just going here and there. So she will think, oh my God, now I'm going to die because I have only complication, I don't have any help. But immediately after complication, if you offer MDT for your extra care and support, or for giving you good support, or for supporting you, make it simple, for supporting you, we'll put you in touch with the expert team. She will be relaxed. Okay, I have many complications, but now I'll be under the care of expert team. Probably I'll be all right. Probably I'll not die with cancer. Probably my baby would be okay. Probably I'll be having a healthy baby and a delivery. So if you go with this sequence, patient will be very cooperative. If you go with this way, okay, now complication, now you started giving the guideline about or guidance about the treatment timeline. Probably she will be okay, but not very happy. Reason, she doesn't know that now who is going to take care of me. But I am to ST5, I cannot do anything. And then you are saying in the end, okay, now you have finished your task, then you're thinking she's getting that relief of, okay, so now I have it. So during this explanation, probably she won't be that cooperative. But if you explain, don't worry, Diana, now you will be taken care by this. Okay. So many healthcare professionals are now going to take care of my condition. Okay. She'll be happy and relaxed. Because we have not abandoned her. You have this condition, now this treatment, go and take yourself. No. This should be your sequence. Always end with this, and thanks for her time. So this is how you have to present all your domains. Now, this is something as well I really want to discuss because I've seen girls, they are not able to understand what is S, what is bar, what is A, what is R. It is very simple. I'll just explain with you diagram. This is the situation. That man is falling down from a hill. This is the situation. This is our concern. This man is falling, he may die. So this is our concern. What was the background? He was walking on some field. He was comfortable and he couldn't realize that there is a fall, there is this thing, and he. So this is situation that man is hanging from hill and he may fall. And what is the background? He was absolutely fine before that. He was just coming back from the office and he was going from his bath or was just comfortable. But suddenly this has happened. What has happened afterward? That is the first thing which you have to address. That is your concern. This is the background. Now the assessment. In assessment, you will address everything. What all information being given to you, that is assessment. Like CTG they have given, that is assessment. KFT they have given, that is assessment. Vitals given, that is assessment. What else you want to know to understand his condition better? That is assessment. What all you want to know to assess his condition is assessment. That could be, basically, that would be mainly in regards to vitals, investigations, biochemical tests, radiological tests, etc. Then it is going to be recommendation. You are boss now. You are guiding. Who all are going to take care of you? What all treatment options you have? How you will be taken care from now until you get discharged or until you get your desired outcome. This is recommendation. So recommendation would be the very first thing. Who is going to see you? Where you will be seen? And then what all we are going to do. Situation is the concern. The first thing which you come to know, or the first thing which appears in a news channel, oh my God, that particular patient or that particular person fell down from the hill, fell down from the third floor or fourth floor, or hanging from the third floor, or hanging from there or there. This is the situation. What was the background? He was sitting in his room, he was drunk, he didn't realize, and he just, how you are going to assess? Is he in his senses? Is he has any medical condition, whether he'll be able to survive until he gets any help? Is he has like any pacemaker or something? Then the recommendation. Immediately inform police, immediately inform ambulance, immediately inform fire brigade. They will come and they'll do the rescue. So first you inform police, fire brigade, ambulance. Then they'll come and they'll do the rescue. And then the steps of the rescue. So this is so very simple. I do not understand why you find it so difficult thinking about S-bar. For labor ward prioritization, it's very simple. You are sitting in your duty room. You get a call from your nurse, your staff. What would be her first question? Dr. Arora, the room number 5, Mrs. G, her CTG showing now late deceleration. This is the situation. This is the situation. Then what would be your next question? Next question would be, will you tell me more about that patient? Okay, she's this patient, this much week, this is the age, and this much her CTG, if it is given, and this. Okay. May I know more about her, or like vitals, like any other surgeries, or whether her BP is fine, and this and that. This is how you are going to take the assessment. Okay, this is the assessment, then you will recommend. Fareed? Nadia, are you there?
Yes, ma'am.
Fareed, you just now drop a message.
Yes, I'm here.
Yeah.
I'm here.
Yeah, both of you just drop a message in a free group that we are going to start egg freezing because
Okay.
15, 16 now, so they can join.
Mhm.
Just drop a message. Okay. So now we'll talk about the labor ward prioritization. So this is the situation. Situation means the main concern, normally the way your staff calls you. Then you ask about the background. What all sisters she had? What's her weeks? What's her age? Is it her first pregnancy? Can you tell me, like, how's her CTG? So somehow in background you are going to utter whatever they're given, but in assessment, in background do not mention about CTG, because in assessment you are going to ask, may I know vitals, may I know comorbidities, may I know uterine contraction, may I know vaginal finding. Okay, CTG is reassured. Then mention it that way. Okay, CTG is reassuring because it is given. It is normally not background, it's normally assessment. Assessment is one thing which you make on information gathering, that is background, and definitely technical tools which you use. Okay, so in the assessment you are going to ask all these questions. Okay, now you can decide. Okay, if late deceleration of 10 minutes, it is not going to be an urgent case, it is going to be a semi-urgent case, so your recommendation would change accordingly. If it is say MSL, but but your CTG is fine, then it is going to be semi-urgent. But if it is MSL with suspicious, for me, it is going to be an urgent case because suspicious with a concerning. So until you do not do the assessment, how will you recommend? As simple as that. Until you do the assessment, how you will recommend? Because if you do not know what's the problem, how you will sort out? Because the problem is not only late deceleration, there is many things which is in background, right? So understand that background, you have to go through the background, then you have to ask the assessment, only then you can recommend. Only then you can recommend, okay, go for this, this is the right person for you, and this is how you should be prioritized, and you need all these things. But what you do in labor ward prioritization, you read and you start recommending. And nowadays in labor ward prioritization, now examiner is quite interactive. So if you ask, they do reply. If you do not ask, you will keep on saying. See, now I'll give an example of another task. PPH happened, say 6 hours back, 7 hours back, right? And you do not know the current condition. How will you prioritize her? What if she's still having hypertension, tachycardia, or still she is having not copious bleeding, but ongoing bleeding, and she's still having her she's compromised hemodynamically. She's going to be an urgent case for you. But she had PPH 6-7 hours back, but now she is hemodynamically stable. Her uterus is contracted. She is having ongoing bleeding, which is nominal, which happens normal after delivery. Then it is going to be semi-urgent case. Then you will not rush. You will send someone else. So until you assess the patient, how will you recommend? Or you recommend something, and once you finish your 2 minutes, then a smart examiner would say, doctor, patient is having this condition. Now you'll again start your recommendation from zero. And for a silly room, you are going to give 4 minutes, which again does not make any sense. Right? So this is suggestion for whoever is preparing for November, and definitely whoever is appearing in this exam. Now, the very important question which has come in last exam, that is egg freezing. I don't know whether they are going to repeat or not. At least like whoever is appearing on 15, 16, they should prepare this task. They should do with this task because at times they do repeat. Okay. So now we are going to start our egg freezing. These are the all points which we are going to cover. Rather, I'm going to cover all the points. Whatever she asks, you should be ready with that. Whatever question she asks, you should be ready with that, because here I'm going to cover these many questions. Probably she will not ask all these questions, but you should be ready with your answer. So whatever she asks, you should know. What is egg freezing? Egg freezing is a method of preserving a woman's fertility so she can try and have children at later date. Even if it comes as SD, you should know. Or if it comes as SPT, you should know. That what is egg freezing? If she asks, what is egg freezing exactly, doctor? It's a method of preserving a woman's fertility so she can try and have children at a later date. At a later date, that is very important. Why we do egg freezing? So we can conceive in later age. So this is a method to preserve a woman's fertility. This is a buzzword. A method to prevent a woman's fertility so she can conceive in later age. Right? And how you do it? If she asks, or if your SD, or if your examiner asks, how you do it? It involves collection of women's eggs, freezing them, and then thawing them later on when we need to use for fertility. Okay, so this is egg freezing. What is egg freezing? It's a method to preserve fertility so she can conceive in later age. And how you do it, or what is exactly what all involves steps and steps. The steps are
Ravneet,
आजो जल्दी आओ, सारे आ जाओ. Farid, please mute yourself. So, collecting women's egg, first you will tell the definition, then you will say what it involves. It involves collecting women's egg, freezing them, and thawing whenever you want to go for fertility treatment. Who can opt for this? This is a very important thing. Who can opt for this? Can anyone can give me answer for this question?
The patient is having any malignancy, so if she want to preserve her egg, that situation we can do that.
Very good. And any other situation?
partner, not partner yet.
Premature, premature ovarian insufficiency.
Lovely. Perfect. If you have a risk of premature ovarian insufficiency, if you have any medical condition or need treatment for medical condition which can affect your cancer. So how you are going to say it? First, if you have a risk of premature ovarian insufficiency, you have any medical condition or need medical condition like premature ovarian insufficiency, or you need treatment for medical condition which can affect your fertility, cancer, chemotherapy, radiotherapy, right? When you are about your fertility may decline, but you are not ready to have child now, we call it as elective egg freezing or social egg freezing. By chance, if your examiner asks what is elective egg freezing or what is social egg freezing, so you should know the reply. So now who is going to answer what is elective egg freezing? I want all to, whoever is appearing on 15/16, that you will prepare this task now itself, then you do not need to repeat it. Who is going to tell me what is elective egg freezing or social egg freezing?
I'll tell, ma'am.
Sure.
Social or elective egg freezing is when someone knows that their ovarian reserve is going to decrease, but she is not ready to start a family yet.
No, that is for post ovarian insufficiency. This elective egg freezing means as of now you're perfect. Your MH is fine, your fertility, you do not have fertility concern now. But because of your profession, probably you are not married, probably you do not have partner, probably you have some other plans, probably you have some financial problem, so you do not want to get pregnant now.
Okay.
But you are afraid that after some time, when you will be 35, 38, probably your fertility would decline. That is social freezing or elective egg freezing. First is the medical condition like POI. Second, any medical condition for that you are taking some treatment which can decline, like cancer treatment, chemotherapy, radiotherapy. Third is the elective egg freezing or the social egg freezing, where as of now you are fine, but eventually because you are not able to, you do not want to conceive because of whatever reason, finances, partner, career issues. So later on, you are afraid that whether if it declines later on, so you want to freeze your egg. Third, when you are at the risk of injury or death, means, for example, if you are a member of armed force who is being deployed to a war zone, even then you can freeze your egg. If you are at risk of injury or death, like if you are a member of armed forces and you have been deployed to a war zone, this is again an third. Fourth one is very common, and I'm sure you all are aware of this. Very common in UK. What is the fourth one? And this is a very important task as well. This is very important task as well. Just 30 seconds. One situation. You have very important task for same. Girls. Female.
And transgender,
Yes.
insensitive.
Gender.
Yes.
Yes.
Gender.
Female transition or through a process of transition to a male, and she wants to preserve her fertility. So before you start any hormonal therapy or the reproductive therapy, she would be at risk of the partial or complete loss of fertility, right? So before you start any hormonal therapy or the reproductive therapy, you are going to put her on, so you're going to go for egg freezing. Or, or in case you have already gone for IVF and you tried for it and it failed, and now you do not want to use the remaining embryo for some ethical reason, like everybody can have their spiritual belief that embryo was taken now and it was failed IVF. Now she wants to freeze her egg. So who is going to repeat it for me fast? Who can opt for this?
I'll repeat, ma'am.
Okay, go ahead.
So risk of premature ovarian insufficiency, medical condition.
No, you'll say any medical condition like POI.
Okay, any medical condition like POI or someone who needs treatment for medical condition that can affect their ovarian reserve like cancer, chemotherapy, radiotherapy. Then social or elective egg freezing, where at the moment they are not ready to start a family, but they are scared that in the long run they may lose their ovarian reserve. Then risk of injury or death, like if someone is a member of the armed forces, and the other is women who are undergoing treatment for how to say that, transgender women before the hormonal therapy.
And that spiritual belief, if some spiritual belief that they don't want to use the embryo or failed IVF and the remaining embryo. See, she has gone for the IVF, there were 2 embryos were remaining and she doesn't want to use it for the future. So how to say this? She doesn't want to have any remaining embryos that were not used after treatment for any ethical reasons. ethical reason, right? For even for any ethical reason, if she has certain belief like this, you can remove this because that is going to be pretty difficult for you to remember. Even if you remember these three posts: medical condition, medical treatment, elective egg freezing. I would suggest everybody make a proper line for social egg freezing or the elective egg freezing. This is going to give you bonus marks in your exam. Risk of injury or death, armed forces, and but obvious transgender. Now talking about the prerequisites. Anybody is aware of test, BMI, consent, and age? I'm sure पढ़ा होगा कुछ लोगों ने because it came yesterday.
Ageless, they're 35.
Who is this? Yeah, do not get afraid. I'm asking because I want to interact you by taking your name.
Okay.
Who is this? Okay, go ahead. Yes, age 35.
Yes.
And
And we can do tests for hepatitis C, HIV.
lovely.
Yes.
Lovely.
Then healthy lifestyle by stop smoking, modify the weight reduction.
And what is the desirable BMI for this?
Less than 30.
Okay.
I think 90 to 30.
Okay. Half correct. Okay.
Ah.
I'll go further with this. Test.
Okay.
Correctly said HIV, hepatitis, chlamydia, cervical smear. Hepatitis, HIV, chlamydia, cervical smear. Desirable BMI is 19 to 25. 19 to 25.
Hi, Dr. Gautami. Hi, Dr. Gautami. Hi, how was your exam yesterday?
Who is this?
Oh,
Who is this? Who is this? I hope this is a student because she was asking about how your exam was or something like that. So I hope it's not a like because I would appreciate if only students are here. So that's the maximum I can say. The rest is your own conscious. Conscious. Okay, move further. Okay, where were you, darlings? We were at test, right? No, we were at BMI, right, Farid?
No, test.
Test. Okay. So
HIV, hepatitis, chlamydia,
hepatitis, HIV, cervical screening, chlamydia. For BMI, ideal is 19 to 25. Anyone who is more than 25, normally they do not advise egg freezing. Now consent. Consent is very important. Consent is very important. It is a legal document. Consent is a legal document that she has to fill. She has to fill that legal document that which will include everything. For how many years? What if she's not there? What she doesn't want to use? That I'll explain you later on. But you have to say it is a legal documentation which she has to sign with certain conditions. Age. Ideal age is less than 35 to freeze the egg. Ideal age is less than 35 to freeze the egg. Now duration. Anybody is aware of duration?
10 years.
Yes, but that is the only. Can't we proceed? Like, can't we preserve it for further if he is willing for? What is the maximum duration?
50 years, I think.
55.
55, yeah.
10 years and maximum 55. In that case, every 10 years you need to do the renewal. Okay. Okay. Allah's has exam in 1 hour. Okay, I'll try to finish it very fast as early as possible, right? So one student is exam in next 1 hour. Okay. So duration is 10 hours, 10 years, and you can have to renew every 10 years if you want to continue it for 55. Numbers, how many oocytes or eggs you can retrieve, or we retrieve in one cycle, that is 7 to 14. Note down everyone, right? I'll just quickly tell, then I'll explain. So whoever wants to leave for the exam, they can leave. Cost is around 7,000 to 8,000 GBP. 7,000 to 8,000 GBP. What about safety? Anybody quickly will tell me about the safety? What all risk? You can say what all risk he is going to have.
Hyperstimulation,
Yes.
infection,
No, I'll just come to the, because I'm really worried that there's one girl who is going to appear. This is mostly safe, though one can have side effect of fertility drug like OHSS, which you rightly said, Pari, that is definitely is there, and that can be potentially fatal as well. So IVF has such, egg freezing and IVF is safe, but there can be side effect of fertility, which can be mild, or which can be severe like OHSS, and that can be potentially fatal. Otherwise, there is no major risk with egg freezing. There is no major risk with egg freezing. Risk means they also want to know that whether if they go with the egg freezing, are they going to have a normal baby? Yes, they are going to have a normal baby if that egg is normal. Irrespective of that, whether it was fresh egg or it was a frozen egg. Success rate is 8 out of 10. They are able to retrieve and freeze the egg. This egg retrieval and freezing success rate is 80%. That is 8 out of 10. 2 out of 10, they won't be able to retrieve and the freeze. What decision I need to make about the eggs? This is again very important question. Anybody understands about this? What all decision? She need to take decision that how long she wants to store. First, what happens to her egg if she dies or becomes unable to make decision? It means mental capacity compromise. So what decision I need to make in about eggs? That is that she is going to mention in her consent. First, how long she wants to preserve it. Second, what if she dies or if there is mental capacity compromise. Whether she wants to use it for herself, whether she wants to donate it, whether she wants to give it for any kind of training, or any other condition you may have for the use of your eggs. If she has something in her mind, then she has to mention all this in her consent. I repeat, duration, what if she dies, or mental capacity compromised, or if she wants to use for herself, she wants to donate for training, or any other specific condition if she has in her mind. So these are the decisions which she needs to take before egg freezing, and she has to mention it clearly in her consent because it's a legal document. What if not renewed? If it is not renewed, so lawfully, the fertility clinic won't be responsible to preserve it further, and they can discontinue preserving it. How to use eggs for IVF? Egg freezing is normally preferred, not the routine conventional IVF, but they prefer ICSI for better success. ICSI for better success. One more thing, okay, that I'll later. Okay, so if she asks that, okay, so how you are going to do my IVF? You will probably will not say that your egg and sperm will meet in lab and you will probably say that the preferred one is a special technique. We call it as ICSI. Who will explain ICSI in layman? Fast.
sperm injected directly into the eggs?
We put, not injected. Injected is again not a, like it's a semi-layman, I would say.
Hmm.
We
Okay.
put egg directly into the sperm.
Okay.
Okay. So that is the preferred one, otherwise conventional. The preferred one is ICSI. What if it does not work? You have freezed the egg. Now you have frozen it for 10 years. Now she's 37 and now it is not working. Donor egg or natural trying. This is something you have to explain while taking her consent. You cannot give 100% guarantee that she is going to have a successful pregnancy with that. Though in safety, one more question she may ask, whether it is going to make any difference if I go with the frozen egg or the fresh egg. Is it going to make any difference, girls?
Frozen natural is same success rate.
Yes.
No difference.
IVF success rate is same for both. What if I don't use that 3 Ds? I just explained. Donate to someone else, donate for training, or dispose. She doesn't want to give it to anyone. She wants you to dispose it off. So what if I don't use or I don't want to use? Then she has 3 options. Donate to someone else, donate for training, or dispose. How to find clinic? You should always go with the registered fertility clinic, which you can find in Human Fertilization and Embryology Authority website. You should go with the registered fertility clinic, and that you can find in Human Fertilization and Embryology Authority website. I think these are the all questions probably she would ask. Should I repeat or anybody else wants to repeat it? Or if you volunteer one by one, because who was this? Who asked this thing that she has to go for exam? It was Allah. So I think she has left already. So should I take the name to explain all the points one by one, so everybody would get the chance? Or if you want to volunteer for this? Aparna? Aparna?
Hello?
Aparna, are you there?
Hello?
Aparna, is you Aparna, darling? Aparna,
Hello?
Aparna, is it you?
Hello?
Yeah, Aparna, I can hear you. Can you hear me?
Yes, yes. Yes, I
Okay,
can
so
hear you.
what is egg freezing?
Actually, I joined a little late. I missed that
Okay.
part. Sorry.
Okay, no issues. So, second is Aarti. Aarti, would you like to answer this question? I want all you to prepare this task here itself. Aarti? Aarti has left. The moment I asked question, she left. Very good. So, Divya? Yeah, Fareen has raised her hand. Definitely second question I'll ask you only. Divya,
Yes, ma'am.
would you like to answer this question? What is egg freezing?
Yeah. So egg freezing is a method to preserve the future fertility and use it on the later date.
Yes. Lovely. Now, and just 3, like you have to mention how we do it, like all those 3 steps.
Yeah. So first we will collect the eggs and then we will freeze them in a method called cryopreservation.
You'll say collect a woman's egg and freezing them. This is egg freezing. And later on thawing them or defreeze them.
Thawing them.
Layman language,
Okay.
you can say defreeze them. Thawing they won't
Defreeze.
understand. So later then they can use for the fertility.
Okay. First we will collect the eggs and then we will freeze them, and later on we will thaw them and defreeze them.
Do not say thaw when it's SPT. Probably they will not understand. So just say for simpler language,
Defreeze.
defreeze. Right?
Okay.
If
Okay,
it
ma'am.
is SD, then you are going to say thaw. Now the third
Okay.
question. Third question, Fareen, you have raised your hand. So what? Who can opt for this? But this you replied earlier also, so I'll use for some other question. Nadia?
Yes, I can say. Who can
Yeah.
opt? That one?
Yes.
Okay. Who is having any medical condition like premature ovarian insufficiency, or who is
Lovely.
undergoing kind of medical disease like malignancy, underwent chemotherapy, radiotherapy,
Very good.
and then who then opted for social or elective egg freezing.
Okay.
And when they are at risk of death or injury, like who is working for armed forces
Okay.
in that situation, and in gender change before opting for any kind of fertility treatment, they can freeze the egg.
Lovely.
And
That's it.
and
That is more than enough. You will pass. You will pass with this much answer. So now Rekha
Thank
is raising her hand. So Rekha, can you tell me the prerequisites regarding test BMI?
Yeah, regarding the test, HIV, hepatitis B, and cervical smears and chlamydia screening, and the BMI should be between the 19 to 25. Written consent should be taken, and the age should be less than 35.
Okay. In BMI, you will say 19 to 25, and if it is more than 35, probably they will refuse.
Okay. Yeah.
Okay. Lovely. So you girls are listening to me carefully. I'm so happy. I like interactive audience. पढ़ाने में मजा तब आता है जब सुनने वाले भी उतने. Very good. Duration and renewal. Pareen.
Hello.
Duration
is from 10.
Not
Maximum
from
can be
10. No, not from 10. 10 years.
Huh.
But if they want
10
to,
years.
they can do it up to 55 years. That 55 is the recent change. That is after, I think, 2020. Okay. Earlier, it was only for 10 years. Or you can say that way as well. Earlier, it was only for 10 years. Now, you can do it for 55 years. Now, say it properly.
Ma'am, it means till she becomes 55?
No. 55 from the
55 years.
date of
Okay. And if she is 30, she can do it till she becomes 85.
Yes, because she can donate as well, no? She can use it for any other family member as well, no?
So duration is, earlier it used to be for 10 years, but now as per new law, it can be done for 55 years. And renewal as per law, it can be discontinued by fertility center if she does not get it renewed.
Okay. And if she wants to renew, then what is the duration? 10 years. After 10 years, she has to renew it.
Okay.
Minimum, she can make a consent for 10 years. Minimum. But she cannot make it for 50 years and 55 years in one go.
Okay.
10 years was the earlier. Now we can freeze for 55 years, but we can give maximum consent for 10 years. You can give minimum that I want to freeze it for 2 years, but you cannot give more than 10 years. Then after 10 years, you have to go for renewal. If you do not go for renewal, then fertility clinic has right to discontinue the freezing lawfully. Divya, would you like to repeat this? Divya?
Yes, ma'am.
Yeah, repeat.
Prerequisites, ma'am.
Yes.
Yes. So prerequisites, first she need to do the test like HIV, HBsAg, VDRL, chlamydia and gonorrhea test, and her BMI should be in between 19 to 25, and she need to take the written consent, and age should be less than 35 years.
And duration and renewal, Nadia?
And duration, okay.
Nadia?
Okay, initially it was actually duration was 10 years. Now in the new law, it has been extended up to 55 years, and every 10 years interval they can.
Up to 55 years. Be wise choosing your word. It will make the sense of your statement.
Up to 55 years now, and every 10 years interval needs to be renewal. And if not renewal, then the fertility clinic will just dispose, I think.
Yes. They can stop freezing it further. Say it that way. If not renewed, then fertility clinic has lawfully right to not to freeze it further. Not to freeze it. Make it very simple. If not renewed, fertility clinic lawfully has a right to not to freeze it further. Number and cost. This is very simple. Who is going to say how many eggs you can retrieve or you should retrieve in this thing, egg freezing cycle?
7 to 10 eggs and
7 to
price
14. 7 to 14.
14. Okay, and 7,000 to 8,000 GBP.
Lovely. Safety. This is a very important question. She's definitely going to ask. What all you are going to include in safety?
Mostly it is safe, but the fertility due to some side effects of the fertility drugs like the OHSS and can be fatal at that time. And also the major risk of egg freezing will be, yeah, I don't remember. Sorry.
Your first one was absolutely fine. Who else wants to try this, Fareen? Would you like to try this?
I don't know anything extra, ma'am. Same thing I know.
So repeat. I'll add
No
it.
major risk with egg freezing, but the use of fertility drugs can cause a condition called as ovarian hyperstimulation syndrome, which can sometimes be life-threatening.
Okay. And it is important to know that as you get older, there may be pregnancy-related complications.
Okay.
Right? That is blood pressure, that is sugar, right? Increased risk of miscarriage because of her own conditions. But because of a younger age egg, there will be less risk of any aneuploidy. Getting my point? Yeah, say yes or no at least.
Yes.
So you have to mention that if she says that, is it safe? It is safe. It is IVF is considered safe. Egg freezing is considered safe, though there can be risk of fertility drug side effects like OHSS, which can be mild, sometimes potentially fatal as well. But I'm afraid conceiving in later age would be having pregnancy-related complications like blood pressure, sugar, early pregnancy loss, losing baby inside the womb in the later weeks of the pregnancy or during the process of delivery. But age-related chromosomal, like differently genetic makeup or abnormal genetic makeup, chances would be lesser. Okay? Everybody is sleeping. Only I am awake.
No, that's fine. Yes, thank you.
Okay.
Then what is the success rate? I want all of you to prepare this task now itself. So you do not need to repeat or revise it again. Whoever is appearing on 15 and 16. What is the success rate?
8 out of 10.
Lovely.
80% is a success rate.
Lovely.
And retrieve and freeze the eggs.
Okay. What does decision I need to make about eggs while consenting?
How long needs to be, how long you want?
Duration, for how long, how I have to preserve if I die and then in mental capacity is compromised, and if she wants to 3D, you told that if you donate to someone else and donate to trainee, or she want to another dispose. Yeah.
I want all of you to answer this question one by one. This is very important question. Everyone start. Pareen. Pareen,
How
fast.
long? Yeah. How long should I freeze? And if I lose mental capacity, then what will happen to the eggs?
What if I die?
What if I die?
Rekha?
Want to use by other person?
Rekha, repeat all again. Nadia, okay, you want to do that? Do it.
Someone
Should I repeat, Dr. Pooja?
Now, let's Nadia try. then you can
Okay.
use it, still not able to.
Okay.
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 Nadia?
The concept should include how long want to store or freeze the egg, what will happen if I lose my mental capacity, or what if I dies, and whether if I want it to use by some other person or for any training purposes,
Or want to dispose of.
or want to dispose. Yeah.
Fareen, now repeat.
The consent should before making a consent, I should make a point like how long should I freeze, what if I die, or what if I lose my mental capacity, whether I want it to be used by someone else or use it for research purposes, or if I want to dispose it.
Lovely. Next. What if not renewal, that we have already discussed? How to use eggs for IVF? What is the, if she asks, doctor, will you tell me how you are going to use my eggs for making me pregnant?
Injecting the egg inside the sperm.
Not injecting.
ICSI will be putting the eggs into the putting the sperm directly into the eggs. So ICSI will be the preferred one, otherwise conventional.
Repeat, Fareen.
Putting the sperm inside the egg with the help of a needle by a procedure called ICSI to improve the success rate.
Nadia?
By put the egg directly into the sperm, which is known as ICSI, to improve the success rate, or otherwise we will go for the conventional method.
Lovely. This is the complete answer, Rekha and Fareen. This is the complete answer. Aparna?
Hello? Yes.
Reply this question, answer this question.
The same question. So we put the sperm directly into the egg to increase the success rate. Otherwise, we can go for the conventional method.
Lovely. Divya?
Yes, ma'am. So we will put the sperm through an injection directly into the egg to improve the success rate of pregnancy, or else we will use a conventional method.
What if it does not work? This is simple. Donor egg or naturally trying, obviously. Aarti? Aarti join, let her join. So is it helpful for you girls? This
Yes,
discussion of
Yes, ma'am.
ICSI?
Yeah, very helpful.
Aarti? Aarti? She vanishes whenever I ask question. Aarti, unmute yourself. Aarti, unmute yourself. Yes. Can
Yes,
you
ma'am.
reply this question, please? What?
Which question?
How to use eggs for IVF?
ICSI.
Oh,
We have to.
Oh, darling. Say it properly. Say it properly.
For this one,
Okay. Who wants to repeat? Nadia, repeat it fast. Divya, you repeat it fast.
Yeah. So we will directly inject the sperm into the egg
Put.
to.
Divya, put.
Yes.
Do not inject. Put. This is layman.
Yeah, put. Okay. We will directly put sperm into the egg to increase the success rate. If not, we will use the conventional methods.
Lovely. Aarti, now repeat it fast.
ma'am, we will inject.
Put,
Sperm.
darling, put.
Layman. Sorry, ma'am. We will put a sperm directly in the egg.
Yes. We call
after
it
thawing.
We call, no, say thaw, say
yes.
Defreeze, after defreezing it.
Yeah,
So
okay, ma'am.
patient won't understand thaw, right?
Okay.
So, how will you say it?
After defreezing, we'll directly put a sperm in the egg.
We call it ICSI. Say it properly, Aarti. Say it fast.
ICSI.
So easy.
ICSI. Yeah.
If not
Yeah,
possible,
okay.
then conventional one. Say
Yeah.
fast, Aarti.
If not possible, then we'll do conventional one.
Yes, perfect. If doesn't work, then donor egg this is. What if I do not use? 3Ds.
Yeah, if we do not use, then we can dispose it, and we can donate it, and we can give it for research.
That's it.
Three we can do.
Donate to someone else. Say it properly. Make complete sentence.
Okay, ma'am. Okay.
Donate to someone else, or donate for research or training purposes.
Yeah. Donate to someone else. Donate for research and dispose it.
Yes, lovely. Fareen, how to find a clinic?
By going how to find clinics authorized by the HFEA.
A registered fertility clinic. This is buzzword. Registered fertility clinic is a buzzword.
Authorized by HFEA.
Yes. You can see it. A registered fertility clinic. You can find out in website of HEF. Okay. Now repeat it fast. We have to finish.
Registered fertility clinic, which can be found out in the website of the HFEA.
Divya, repeat.
We need to find out a registered fertility clinic. Last word I didn't understand, ma'am.
What is the full form HEA? Kaun bolega?
Human
Okay.
Fertilization and Embryology Authority.
HFEA, okay.
Repeat again, so everybody can remember this. Repeat.
Human Fertilization and Embryology Authority.
It's so simple. Okay?
Human Fertilization and Embryology Authority.
It's HEFA. Okay?
HEFA, okay.
So how to find a reliable clinic? Is it clear? All questions clear? I don't think that she's going to ask more than these questions. Yes, one more thing. In test, we'll do a AMH as well. AMH as well.
Yeah.
It's AMH. So how you start? Chlamydia, HIV, hepatitis, cervical screening, and AMH. BMI 90 to 25, more than 25 we do not do. Consent is very important. It's a legal document. More than 35, it's not advised. So what is the preferred age of taking it? Doing it?
35.
Less than 35. Duration 10. Earlier it was 10. Now
10
it's
years or up to 55.
But now we have to make a minimum. It could be any duration. Maximum 10 in one go. Then you have to do renewal. And maximum you can freeze it for 55 years from the date of egg freezing. Okay? 7 to 14 eggs in one egg freezing cycle. Cost of one egg freezing cycle is 7,000 to 8,000. Safety, IVF or egg freezing is considered safety. Fertility drug has its own complication, but if you try in the later on pregnancy, so pregnancy related complication, aneuploidy or miscarriage because of the aneuploidy would be as per your age of egg freezing. So it won't be higher. Success rate 8 out of 10 women. And what all decision I need to make? This is very important question because this will ask. What all decision I need to take? Again, Fareen, repeat it once, then we'll just wind up.
How long should I freeze? What if I die? What if I lose my mental capacity? Whether I want it to be used for research purpose or I want it to be disposed of.
Lovely girls. All the best. And whoever is preparing for November, please follow the instruction which I have given about how to make a template. That is going to help you a lot. Trust me on that. Make it simple. Do not complicate. Use algorithm. Fareen, whoever is appearing in this exam, give a proper timeline. It should be BBN, diagnosis, complication, risk factor, MDT. Then your time. All the best, everyone. Take good care of you and make me proud. Okay?
Thank you, ma'am.
Welcome, darlings.
Thank you, ma'am.
Yeah, study hard, study well. Do not lose your focus. Do not look at others. You all are very well prepared. The only thing, just do not lose you will be nervous. Take it that way. Do not lose your control on your nerves in spite of being nervous. That is very important. I'm presenting this, I'm taking your live session. I'm also nervous. Could you make out that I was nervous? Any of you? Nadia?
No.
Could you make out that Akshika has joined now? We have finished. Ashika, we have finished with our session, darling. We have joined very late. So, Divya, was I sounding ki okay, Dr. Pooja is nervous? No. Pari? No. But I was nervous because presenting a live session in front of so many people who are like equally intelligent and knowledgeable, but I was able to appear it that way that I'm not nervous. Okay, this is how you have to do in your exam. All the best, all the best. Now do not waste your time. Go and study. Bye bye.